The U.S. Surgeon General, Dr. Vivek Murthy, is pushing Congress to require warning labels on social media platforms, kind of like how it does on cigarette packages and alcohol. Dr. Murthy has declared that a mental health crisis exists among young people, and he says that it's contributed to by social media. Our medical expert, Dr. David Winter, joins us to discuss this topic this morning. As I want to say good morning and welcome to you, sir. What is your view of social media's effect on adolescents?
Well, it's complicated. I'll tell you, the Journal of the American Medical Association has published data saying if your teenager's on social media for more than 3 hours, they have double the chance of being depressed. They also say that they're more likely to be distracted from getting adequate sleep, from exercise, family activities, and they'll be exposed to illegal activities on social media, things that may encourage self-harm, harming others. They're more likely to have eating disorders, a lot of reasons to be worried about social media and your teenagers.
You know, I've talked a lot about this topic at our digital parenting series that we air here at WFAA, and one thing that we do know is that not all screen time is created equal. Just because a kid spends a lot of time on a screen doesn't necessarily mean they're on social media. Is there something unique about social media specifically that makes it more harmful than other forms of screen time?
Yeah, so social media allows anyone, but a teenager in particular, to give and receive information, to get a dialogue back. So with that, you can have some of your ideas shaped. Now, it's not all bad. You can develop friends that way. Your teenagers can. They can get encouragement about what they're doing. They can get advice during the complicated times that teenagers go through. The point is that teenagers are at a very vulnerable time in their lives, and social media can actually help them and actually lead them the wrong direction, Mark.
I think the wrong direction part is certainly what has people concerned about too much use of social media. What advice would you give parents that are trying to navigate these waters about, how much time they should let their kid use them, or maybe even delay them getting some of these social media accounts?
Some authorities are saying that children under age 13 should not even be allowed on social media. And between 13 and 17, they should be very carefully supervised with this. I would say this: if your child looks like they're becoming sleep deprived, if they're becoming less confident, becoming insecure, getting some radical ideas, you might want to talk to them about social media. You might want to that might be the clue that they're getting more involved with social media on the dark side.
Look, the experts say talk to your kids about social media. I know there are a lot of parents that are like, yeah, I can try talking. They're not necessarily going to talk back. Do you have any advice, though, for parents about how they can kind of start these conversations and really keep their kid engaged when it comes to these topics?
Yeah, that's a good point. Teenagers don't always want to hear what you want to tell them. I think the first thing you could do is be a good role model. If you're on social media a lot yourself, that's not working very well. You might have times like at dinner, we're going to put our cell phones, our computers away, we're going to talk. Other times with family activities, do that also. It's just, with kids, you need to help them. Talking frankly about how you feel about it and get their ideas, not so much telling them, but trying to get a dialogue going. All those things I think can potentially help. Just be understand that social media is a potential danger out there for our kids right now. Good parts, bad parts, but keep in touch with your teenagers. They need their help.
Well, that's great advice, and I know that some of the experts say, one of the hard things is that we've got one of the most interesting devices in the world in front of us as parents, and if we can't put it down, it's hard to ask our kids to put them down as well. Some great perspective this morning, Dr. David Winter. Thanks for sharing it with us.
Indeed. Thank you, Mark. Good to be with you.
Good, as always, to catch up.